Hey everyone, we've got another specimen today. This is number 839 in our collection. The heart would have sat roughly in the chest like this, anterior surface here, posterior surface towards the turntable, inferior surface or legs down here, superior or head up here, left over here, and then right over here. Let's go ahead and start off by trying to identify what externally looks like the right atrial appendage. And unfortunately, the right atrial appendage has been removed here, but this does seem to be the remnant of it. And remember, usually the right atrial appendage is triangular in shape, broad-based, or pyramidal in shape. The pectinate muscles do seem to spill outside the confines of the appendage, consistent with the morphologic right atrium, but a majority of the right atrium here has been removed, as has a majority of the left atrium next to it. This does give us a unique opportunity to kind of look down at the right-sided atrioventricular junction as well as the left-sided atrioventricular junction. So that is kind of a nice benefit of having this dissected the way it has been. If we look down on the right-sided atrioventricular junction here, we do see that there is a atrioventricular valve which appears to have 1, 2, and then 3 leaflets. Consistent with the tricuspid valve, we do see that this valve leaflet here does appear to have connections to the ventricular septum. And we'll take a look at it from the ventricular aspect now. And we do find that in fact there are 3 leaflets like we saw before, 1, 2, 3, and that there are direct connections of one of these valve leaflets to the ventricular septum, all consistent with the morphologic tricuspid valve. So this would be the anterosuperior leaflet, this would be the septal leaflet here, and this would be the inferior leaflet of the tricuspid valve. Now when you look behind the septal leaflet here, there does appear to be a perimembranous ventricular septal defect. And you can see that it appears that the septal leaflet of the tricuspid valve is actually attempting to close off this ventricular septal defect. When we look at this ventricle here, it does appear to have coarse trabeculations. There is a septomarginal trabeculation here, and you can appreciate the Y of the septal band. So here's the septomarginal trabeculation, here's the cranial limb, and here's the caudal limb, and you can see that the outflow tract is entirely intact. There is no outlet ventricular septal defect. With the lighting, it might be a little hard to see up this outflow tract, but there is a valve here with 1, 2, 3 leaflets, consistent with what appears to be a pulmonary valve. And this valve is completely supported by muscle. There is no fibrous support of this valve. So here is the pulmonary trunk, and we do see that the pulmonary trunk gives rise to the left and the right pulmonary arteries. And there's a nice little incision made here. And let's see if we can actually go ahead and view the pulmonary valve kind of top down. No guarantees. I'm not sure if I can get the angle and the lighting right on the video. But let's give it a try. I'm sorry if it takes a few moments, but it is a unique opportunity if I can get this to work, which it doesn't look like I will, but if we look down at this valve, there do appear to be 3 leaflets and 3 sinuses, and there are no coronaries arising from it. So a morphologic pulmonary valve, and I'm sorry and I apologize, I couldn't really get a good view of that pulmonary valve for you on the video looking down at it. If we go to the posterior aspect of the heart, there we go. We once again appreciate that the 2 atria have largely been dissected. Now when we look down to the left atrium here, we do see that here's the orifice or the mouth of the left atrial appendage. All the pectinate muscles are confined to within the appendage itself, consistent with the morphologic left atrium. The vestibule itself is smooth-walled. And then we look down at a mitral valve here, or at least a 2-leaflet atrioventricular valve on the left side. And it does appear to have 2 leaflets. Here's one, and then here's number 2. And so consistent with a morphologic mitral valve so far, obviously the next feature of it would be looking at whether or not this has direct connections to the ventricular septum, which here is the ventricular septum. There are no direct connections of this mitral valve to the ventricular septum, so consistent with the morphologic mitral valve. Now, when we look at this valve, once again, we do appreciate here's the anterior leaflet, here's the posterior leaflet. But there is something unique about this mitral valve. And here, we do notice a deficiency in the anterior leaflet, which is consistent with a cleft mitral valve. So there is a cleft in the anterior leaflet here. So once again, while we look down at this, here's the anterior leaflet of the mitral valve. Here is the posterior leaflet. I'll try to get this lighting right. Here's a posterior leaflet of the mitral valve. And in this anterior leaflet, there's this little piece right here that seems to be missing, and that is the cleft. So here is one portion of the anterior leaflet, and then here is a little portion of the anterior leaflet, and this space in between is a cleft. The actual zone of apposition of the anterior and the posterior leaflets here would be right along this margin here. So this is not a commissure, this is not a zone of apposition, this is truly a defect or indentation in the anterior leaflet of the mitral valve, which is what the definition of a cleft is. Now, it is important to recognize what this definition is and hold true to it, because we often can claim that there is a cleft in the left atrioventricular valve, or the left-sided component of a common atrioventricular valve in the setting of atrioventricular septal defect, which that is actually a trifoliate left-sided AV valve component, and actually represents a commissure or zone of apposition between the superior and the inferior bridging leaflets, and so in fact is not truly a cleft. Now, this might have to be surgically closed to prevent regurgitation at the time of an AVSD repair, but once again is not a cleft. And there's no sense in calling dogs cats just because we feel like it and our friends will still understand what we're talking about. Language should be used efficiently and concisely, and I think it's important to make sure that we try to ensure efficiency in how we use our words and consistency in how we use our words. So once again, anterior leaflet of the mitral valve, and here is the cleft. Now, if we look at this ventricle here, it does have fine crisscross trabeculations consistent with a morphologic left ventricle. Now, when we look at the ventricular septum, we do find that there in fact is a ventricular septal defect and is in fact perimembranous. There is continuity between the fibrous valvar leaflets of the mitral valve and the tricuspid valve through this defect. So here's the septal leaflet of the tricuspid valve. Here's the VSD back here. And here, now we see hemostat coming out the other side, and we see that in fact there is fibrous continuity between the mitral and the tricuspid valves here, consistent with a perimembranous VSD. When we look at it from this aspect, it's a little tougher to appreciate the cleft, but the cleft is roughly right here, okay? I'm sorry with the lighting, I know it's a little tough to see from some angles, my apologies. And if we look down, we do see the left ventricular outflow tract here. Here's the left atrial appendage. Here's the ascending aorta here, transverse aorta here. Here's the brachiocephalic artery. Here's the left common carotid, and here's the left subclavian artery. And then once again, pulmonary trunk, left pulmonary artery, right pulmonary artery here. And so a heart with a central perimembranous VSD, which by definition has the continuity between the mitral and the tricuspid valve leaflets through the defect. And then a cleft mitral valve here, which we'll take a look at one more time from the top. So here's the anterior leaflet, here's the posterior leaflet, and the anterior leaflet has this deficiency right here. Here's one component of the anterior leaflet, here's the other component. This is not a zone of apposition or a commissure. This, in fact, is a cleft. And you can see how there would be some degree of regurgitation from this insufficiency or deficiency in the anterior leaflet of the mitral valve.